So we need more openness, trust, and respect among veterinarians and medical doctors. We basically need better understanding among vets and medical doctors of how different disciplines can actually benefit human and animal health. So all of this ideally should start from their pre-service trainings. Medical and vet students should be exposed to these issues during their studies. The medical students should be given the learning opportunity to gain a broader understanding of disease ecology, for example. And on the other hand, veterinary students needs to be more exposed to social sciences and should understand the importance of human behavior in the surveillance and control of animal diseases and also zoonoses. So in practice, cross-disciplinary training, interprofessional education would be a great place to start. One Health is a multi-sectoral and transdisciplinary approach. So we need to be mindful that there are barriers for transdisciplinarity at different levels that needs to be addressed. So most importantly, barriers at institutional level, as many of these medical doctors and vets are affiliated to certain institutions. So we need to systematically think of these barriers at key institutions. And these barriers may vary from setting to setting, but we do have some ideas of some common issues across the setting. I mean, this for the barriers include, for example, institutional and administrative constraints, because many of these institutions and administrative system are organized around long-established disciplines and traditions. We also have issues of disciplinary boundaries of professional journals and societies. We also have issues with disciplinary preference and mandates of funding agencies. And you also have issues of disciplinary-based career path. So if you think of this, we can think of several possibilities. So for example, developing transdisciplinary initiative or institution, or promoting transdisciplinary conferences or journals, or establishing transdisciplinary funding schemes, or even establishing transdisciplinary career tracks. Now, in short, we need to encourage and support key institutions, particularly in low middle income countries, to reduce institutional barriers to transdisciplinary activities and teams. And in short, we need to encourage and support institutionalization of One Health. So AMR data in Indonesia is limited. Indonesia just started to join the Global Antimicrobial Resistance and Use Surveillance System, GLASS, that's in 2019. The data for GLASS has been limited to 20 selected hospitals, which act as sentinel sites for AMR data. But the results at the least show that in 2019, there was an increase in the percentage of antimicrobial resistance for some bacteria, such as E. coli, K. pneumonia, and this includes fluoroquinolones and third-generation cephalosporins. Now, another surveillance study, which was conducted in 2017 on E. coli and K. pneumonia, which cause urinary tract infections, revealed that resistance to commonly available treatments was quite high in Indonesia. Now, all of this indicates that Indonesia has a quite high level of antimicrobial resistance as other Southeast Asian countries such as India or Bangladesh. And the challenge of AMR in Indonesia is facing is similar to those of many other low and middle income countries. So the main driver are misuse and overuse of antibiotics in human and in livestock and aquaculture. I mean, these are the key drivers. We had a large nationwide survey which was conducted by the Ministry of Health, which shows that about 10% of the household kept antibiotics in their homes, and 86.1% of them obtained these antibiotics without a doctor's prescription. A recent study that our team participated also confirmed that dispensing of antibiotics without prescriptions at drug outlets is quite common, despite regulations prohibiting this. So enforcement of regulations around antibiotic use, especially in the private sector, continues to be one of the weakest points in our AMR containment strategy in Indonesia, and most likely also in other low and middle income countries. Stronger enforcement of existing regulations, I think, is important because there are regulations out there, but the enforcement is weak, so strong enforcement is important. But we know that's unlikely to provide a complete solution to the problem. So in any case, we need a multifaceted approach. Experience do indicate that multifaceted interventions are more effective than single interventions when it comes to complex problems like AMR. So for me, this would encompass strengthening surveillance of AMR and antimicrobial use in human health and livestock, also having a comprehensive strategy for raising awareness. In Indonesia and in many other low middle income countries with large and informal private sectors, we need concerted action to engage both pharmacies and drugstores also to reduce AMR. Now, last but not least, we need to transform global and national level policies on the ground. So here, I think we need to harness the potential of implementation science, implementation research to be able to systematically identify and address key bottlenecks to policy implementations for antimicrobial resistance. Addressing AMR effectively using a One Health approach requires an efficient, robust, and multi-sectoral surveillance system as a key tool to steer action and also assess its effectiveness. WHO, for instance, have developed what they call the 3-cycle protocol for global surveillance on extended spectrum beta-lactamase producing E. coli. So this protocol describes the implementation of a simplified, integrated, trans-sectoral surveillance system for bacterial resistance to antibiotics. This surveillance protocol uses a One Health approach addressing 3 aspects of bacterial resistance: human health, food chain, and the environment, in a simplified and feasible manner designed to provide robust and valid surveillance outcome using minimal resources. Now, they've recently piloted this protocol in Indonesia, and this pilot successfully identified that the proportion of ESBL producing E. coli was very high in all types of the samples which was collected. And they also identified several challenges and obstacles which were encountered during the implementation. So there are still rooms for improvement because it was a pilot, but nonetheless, I believe multi-sectoral surveillance system as described in the tricycle protocol would be an excellent place to start for addressing AMR using a One Health approach.